Here I would like to explain one case under medical negligence, which is Hasniati binti Hassan and Anna against Kerajaan Malaysia. So the fact of this case is there are two plaintiffs, which is the first plaintiff, Hasniati binti Hassan, was a pregnant woman who faced severe complications during childbirth. The second plaintiff was her newborn child who was born prematurely with medical complications. Hasniati underwent an emergency cesarean section at Penang Hospital, during which she suffered the removal of her uterus, right ovary, and fallopian tube due to complications. Unfortunately, the baby also sustained injuries, including the amputation of his arm due to medical errors. Next, let's focus on the issue whether the medical professional breached their duty of care, which resulted in injuries to both the mother and the child during childbirth. So the court held that the government of Malaysia had indeed breached their duty and was liable for medical negligence. To establish this, the law examines three core elements, which is the first one is duty of care, the second one is breach of duty, and the third one is damages. So there are three elements can be applied under negligence, which is the first one is duty of care. Healthcare providers had a duty to diagnose complications, treat the issues promptly, and warn the plaintiff about the risks associated with the procedure. In this case, the failure to recognize and manage the complication lead to severe injuries. The second element is breach of duty. The court found that the government was liable because safety measures were not accurately maintained and the healthcare team failed to meet the expected standard of care. And the third element is damages. As a result of this breach, the plaintiff suffered measurable harm, including physical injuries, financial costs, and emotional distress directly linked to the negligence. So this case emphasizes the importance of maintaining a high standard in medical practice. It serves as a reminder of the legal obligations owed to patients and severe consequences when these are not upheld. So that's all from this case.
The next case is Iris Nurhana binti Alfian, an infant swung by her father, and litigation representative Alfian bin Zainuddin and Darul Aiman Sendirian Berhad and another 2024. The facts of this case is the appellant, an infant, suffered a brachial plexus injury during her birth in September 2013 at Putra Medical Center, PMC, owned by the first respondent. The delivery was conducted by the second respondent, who is a medical officer employed by PMC but not an obstetrics specialist. The injury allegedly resulted from excessive traction applied by R2 during a vacuum-assisted delivery, complicated by a shoulder dystocia. The respondent denied shoulder dystocia, attributing the use of vacuum extraction to poor maternal effort due to the mother's exhaustion. The High Court dismissed the claim, finding that maternal exhaustion justified the procedure. The appellant appealed, alleging R2's negligence and seeking to hold R1 vicariously liable. The Court of Appeal decided that R1 was vicariously liable for R2's negligence. Moving on to the discussions about the elements of negligence. So, the first one is duty of care. For medical negligence, in order to prove that the person has a duty of care towards the patients, there are three things that we need to examine. The first one is duty to diagnose. R2, as the attending medical officer, had a duty to assess the situations during labor and identify any complications. The second one is duty to treat. R2 opted for vacuum extraction to assist the birth. However, her treatment was questioned because the vacuum extractions was undertaken without a clear justifications. And the third one is duty to warn. R2 had a responsibility to inform the mother about the risks associated with the vacuum extractions procedure, especially in the presence of the potential complications such as a shoulder dystocia. The second element is breach of duty. R2 undertook vacuum extraction without a clear evidence of maternal exhaustion. The claim of exhaustion was unsupported by contemporaneous medical records and contradicted by the mother's testimony and expert opinion. Also, R2 did not provide any adequate advice to the mother about the delivery options and their associated risks. The third element of negligence is damages. First one is factual causations. The brachial plexus injury suffered by the appellant was linked to excessive tractions applied during vacuum delivery. The appellant's expert testified that such injuries are uncommon without the presence of shoulder dystocia. The causation evidence is the appellant's expert argued that the injury could only be reasonably explained by excessive traction during vacuum extractions. Last one is but-for analysis, or also known as but-for test, which is if shoulder dystocia had been managed properly, with alternative method like manual delivery or careful control of the vacuum, the injury might have been prevented.
For the next case, which is Dr. Nur Iman Rahmatullah Khan against Ampang Puteri Hospital Sendang Berhad and another, the facts of the case was the plaintiff sued Ampang Puteri Hospital Sendang Berhad and one of its physicians for injuries caused by a percutaneous disc coagulation treatment (PDCT) technique used to treat neck and back discomfort. D2 performed PDCT operation at D1's hospital. Nonetheless, D2's third attempt to deliver the laser at the C5 C5 and C6. This level was unsuccessful due to a bent ladder. Held dismissing the plaintiff's claim against D1 with costs around 30,000 ringgit to be paid by the plaintiff to D1 and allowing the plaintiff's claims against D2 with a cost of 70,000 ringgit with additional cost of 15,000 ringgit for the interlocutory application. D2's decision to treat the plaintiff's complaints by PDCT pertains to the question of diagnosis and treatment. The test propounded in Bolam against Fern Hospital Management Committee has long had been to be the locus classicus by the Malaysian courts on the standard of care in matters of diagnosis and treatment. At the time the plaintiff presented herself at Ampang Puteri Hospital, she had been in pain for 2 years prior. Both the D1's and D2's experts opined that if conservative treatment in the past had not been effective in addressing her problem, and which was established in evidence, PDCT would be indicated. The plaintiff's expert conceded that PDCT, which is non-standard treatment, may be considered if all other standard modalities like physical treatment, rehabilitation, and analgesics had been tried to the optimum. All in all, the defendants owed the plaintiff duty of care as a patient, and the PDCT procedure undertaken at the cervical region to address the plaintiff's problem is acceptable treatment of her pain. D2, in cross, said that it was possible for the needle to become bent due to the heat transfer to the disc. D2 explained that the disc at C5 and C6 was burned twice at 150 joules. Therefore, court did not find any credible evidence adduced to establish negligent mishandling of the equipment, nor any lack of skill on the part of D2s in conducting the PDCT procedure. The issue raised is therefore one of the causation. In the context of medical negligence, the court have held a plaintiff is merely to prove that it was 51% likely that the defendant negligent act injured plaintiff, as judge have not found it to be so. The question of the defendants causing the plaintiff to suffer an increased risk of adjacent segment degradation does not arise.
Nor Arisa Naura, nor Afrizal, and another against Dr. Abrami Kunasilan and Organisation 2023. The fact of this case is, this case arises from medical negligence at Hospital Selayang, where delays in performing an emergency cesarean section on March 17, 2019 led to catastrophic outcomes for the plaintiffs. The first plaintiff, a child, suffered severe brain damage due to the delayed delivery, despite signs and symptoms of bradycardia, a fatal distress detected at 8 p.m. The second plaintiff, the mother, who had a high risk obstetric history, developed worsened depression from the ordeal and took unpaid leave to provide constant care for her child, who is entirely dependent on others for basic functions. The court decision. The court awarded 209,172 ringgit in special damages, 500,000 in general damages for the first plaintiff, 140,000 for the second plaintiff, 350,000 in aggravated damages, and 6,954 and 156 ringgit in future damages. Duty to diagnose. The delay in recognizing and addressing bradycardia constitutes a failure in timely diagnosis. A competent medical team will have identified the critical condition immediately and acted accordingly to prevent harm. This breach of duty directly resulted in the first plaintiff's brain damage. The second one is duty to treat. The defendants breached their duty by failing to act urgently. The delay caused prolonged oxygen deprivation, resulting in permanent disabilities for the first plaintiff. The treatment provided was neither timely nor adequate, and this failure aggravated the harm. The third one is duty to warn. By failing to warn the mother of the risk, the defendants deprived her of the opportunity to make informed decisions. This lack of communication breached the duty to warn and contributed to the plaintiff suffering breach of duty. In this case, the defendants breached their duty by delaying the decision to perform an emergency cesarean section despite clear signs of bradycardia. The bradycardia observed at 8 p.m. was a warning of impending oxygen deprivation, yet the decision was an emergency procedure was not made until 9:20 p.m. with the delivery occurring at 10:40 p.m. This delay of more than 2 hours fell below the standard expected of a competent medical team, as prompt delivery is critical in preventing hypoxic injury to the brain. The hospital staff further compounded the breach by failing to adhere to accepted hospital procedure. Damage. The first plaintiff has suffered a lifelong impairment in terms of body and mind, which will require constant care and therapy, while the mother has suffered extreme emotional damage coupled with financial pain. The court therefore awarded damage to cover special costs for general pain and suffering, aggravated injury as a consequence of deferred admission of liability, and future medical expenses and caregiving. The compensation was meant to bring back lost quality of life as much as was possible from the negligence of the defendants.
Hi everyone, my name is Arvind Saravanakumar, and now I am going to present a case which related with medical negligence. It's about Shalini Kanagaratnam against Pusat Perubatan Universiti Malaya and annulled 2016 Malaysian Law Journal 742. Fact of the case is the appellant Shalini Kanagaratnam underwent a surgery performed by the second respondent, a doctor at Pusat Perubatan Universiti Malaya. She got know that she was diagnosed with a malignant tumor and lead to removal left ovary. This rendered her unable to conceive. Later, Shalini alleged that the diagnosis was erroneous and claimed a medical negligence, asserting that she did not have cancer. She was relied on the report from an Indian doctor but failed to provide enough evidence and the testimony during the trial. In tort law, to establish claim, the claimant must prove 3 elements, which is duty of care, breach of duty, and damages. According to the duty of care, in this case, the second respondent, as the healthcare provider, owed a duty of care for the appellant to ensure accurate diagnosis and appropriate treatment and proper surgical procedures. The existence of this duty was undisputed as it is a fundamental obligation in the doctor and patient relationship. According to the breach of duty, in this case, the appellant alleged a breach of duty by claiming she was wrongly diagnosed with a malignant tumor and subjected to unnecessary surgery, but she failed to provide expert evidence to demonstrate the respondent actions deviated from standard medical practice, and court found no breach on this case. For the damages, in this case, the appellant claimed that the unnecessary removal of her left ovary resulted in her permanent infertility and emotional distress. The court concluded the appellant did not prove causation because she failed to provide sufficient evidence linking the respondent, and her claim for the damages was rejected.